Hi guys, I'm Dr. Sameera Gupta, physio-occupational therapist, specialist in sports medicine and weight management. Hi Alka, how are you?
Hi, Rita.
Sorry, there were
How are
some
you?
glitches. A very good evening to you and a very good evening to our audience. I'm Dr. Sameera Gupta, physio-occupational therapist, specialist in sports medicine and weight management. So today, I would like to invite my team, my consultant, Dr. Alka Valavarkar, clinical dietitian and nutritionist. A very good evening, Alka.
Thank you so much, Sameera, for having me on this platform. And a very good evening to all the people who have joined us. And I will try to answer all the questions which have come for me.
Yes, Alka. So basically, I would just like to spend a few minutes before we start answering all the questions. The viewers can feel free to ask questions on this chat button too. So I, Dr. Sameera Gupta, physio-occupational therapist, specialist into sports medicine and weight management. Today, for 23 years and more, I have spent my life in dealing and helping patients deal with their aches and pains and the issues of weight gains. So, a mother of two children and married to a successful businessman from based out of Mumbai and Dubai, have dealt with a lot of patients out there dealing with their aches, pains, and the issues of weight gain. So if you have issues of diabetes, blood pressure and thyroid, PCOD, or even cancer, we are one-stop shop where we are helping patients dealing with their issues along with pain and their weights. So in my journey, where I have graduated from, say, GS Medical College in occupational therapy from KEM Hospital in the year 1995, I have spent 23 years of my life helping people come out from their issues of physical, mental, and their weight issues. So when we are looking at cases who are dealing with so many issues nowadays, where diabetes, blood pressure, and thyroid, and so many other issues are there, I have come across one really nice person whom I would like to introduce to you is Dr. Alka Valavarkar. So today, we as a team have worked through the years and also in the lockdown period, helping people deal with their medical issues, mental issues, and also their diet issues. It's not always about eating a dietitian's diet, or just starving. It's about eating right. And that is when Dr. Alka Valavarkar would be soliciting all your questions, the questions that we have been asked with our online consultations and also in our consulting room. I have spent 16 years of my life at Sujay Hospital since 2005 onwards, dealing with these issues of weight programs and pain issues. And now at NM Medical Card also in Bandra, I have introduced a certain line where I'm helping a lot of patients out there with the help of my team. That is one of the most important part is my dietitian, who will be throwing some light on certain questions which have been asked. So Dr. Alka, I would like to ask you, what are the common questions that you think are being asked in this lockdown period?
See, the most common question which I have encountered is how do we manage our weight during this lockdown? Very important thing which is required for a regular healthy routine. You can maintain your weight, you can maintain your health is gymming, which is absolutely absent nowadays. You just cannot go to a gym.
Yes.
Yeah, so the people are, worried, like, what to do with proper diet. See, to maintain optimum health and optimum weight, diet plays a major role. So even if you're not able to access the gym, you can do it at home by proper eating, balanced eating, and some sort of an exercise which you can manage at home, like body weight exercises or yoga. But eating right and healthy is very important to maintain a proper weight and proper status of health. So, a lot of people, that we are saying, yeah.
My question is, what is the meaning? Can you throw on some light on eating right? We are all talking about eating right. So you're eating right, I'm eating right, but what is the audience eating? Can you just throw some light?
See, people to lose weight. Okay, to lose weight, people go on a starvation mode. They go on the internet, they read various diets, and they start implementing it in their lives. Okay, especially in this lockdown, people have become very internet savvy. So all the extra time they're spending on internet, gathering information which might not be suitable for them to take it up, because this is all very personal and customized. Something which is good for you might not be good for me. Something which is good for me might not be good for you. So just picking up any information and implementing into your day-to-day life is going to cause you more harm than benefit. So it's always better to go to a professionally qualified person and take a diet, take an exercise routine, and then follow that. Because
And what I understand, what I have understood from you and from the rest of us, at least who are now internet savvy, and now we are also a lot online. You could be in Delhi, Calcutta, Mumbai, London, Bangalore. We are all just a click away. And I think you're doing some amazing work. We are all kind of, trying to do some amazing work out there. Yeah. So that's good. I think a professional guidance is very important. So Alka, tell me one thing. What about this ketogenic diet that we are all talking about? A lot of questions have been coming around on this particular diet.
Yeah, that's the latest fad. People think that keto diet is some shortcut method or a very fast method to lose weight. But the fact is that actually it was evolved or developed to treat epileptic patients. It has been developed for the medical condition, not for a common or normal person to lose weight or do things. Okay, we do give keto diets to certain people if it is required. Firstly, it has to fit your lifestyle, because it is not very easy to follow a keto diet. And secondly, you really need it. You don't have any other method. Otherwise, on long-term basis, keto diet is not recommended. For short-term gains, yes. For short-term, you want...
But why would you say that it's not recommended for long-term gains? As in just throw a light, because a lot of people are very convinced. People are convinced that, अरे मेरी friend का 11 किलो उतर गया, मेरे भाई का 10 किलो उतर गया. What is the whole scenario? Can you just throw in some light? What that one thing that you have to follow in ketogenic diet that is something which is detrimental?
See, in keto diet, we use fat as the energy source. Okay, so the body, which is actually otherwise using glucose, especially the brain, starts using ketones, which is the end product of fatty acid oxidation. So when you have too many ketones in your body, there are possibilities that you develop gallstones. It means you can end up in a medical condition if you don't do it rightly first thing, or if you overdo it. So that is a very difficult thing to, first thing, never do it on your own. Never do it without a medical supervision. First caution. Second caution is that long term, if you do it long term, there can be certain side effects. So, and as a matter of fact, you don't lose more weight on keto by creating, you can lose equal number of kgs. It's not that it is a magic pill. Okay, because initially what you lose in keto diet is not your fat, it is the water. When you start having a low carbohydrate diet, your glycogen levels go down, and so water quality in the body goes down. So the moment you start eating that carbohydrate again, all the water comes back. So initially what you are losing very fast, not the fat actually, that is the water. Then it goes on fat loss. And this, if you continue with this diet for long term, you can have certain side effects which can be detrimental to your health.
Okay, so my question is here, we have a lot of diabetics who are there, you have patients with PCOD. Do you recommend patients with diabetes and blood pressure to go on to this keto diet?
Diabetes and?
Blood pressure patients.
See, diabetes patients we can do, but under strict medical supervision. But in case of BP, we have to be more careful. Diabetes patients do benefit a lot from the ketogenic diet. I said in the beginning that if you have a medical condition and it is suitable for your needs, then go for it. Just like that, just don't go for it. Diabetes patients do benefit a lot from ketogenic diet, but again, under strict medical supervision, not on your own.
You're so right, because see, remember we have treated the one patient with cancer and diabetes.
Yeah.
She was insisting on me, recommending you for a ketogenic diet, and I was very, very skeptical about it. We did amazing. She did amazing online exercises with me. She was 67 years of age. I think you did a wonderful job of giving her a fantastic diet. I think what we believe is on eating right, avoid starvation, avoid long gap between your meals. And what is the key part of an integrated part of a diet? Like, what do you think is very, very important in today's time?
See, the most important thing, the diet, it should provide you all the nutrients. Okay, you should not be taking any diet which is not providing with all the nutrients. You don't want to lose weight and look old. You don't want to look haggard. You don't want to lose all your hair. Okay, so you don't
That's
want
a
to
very
lose on the
common
blow.
thing. That's a very, very
Yeah.
common condition.
So
Very
if
good.
you
I'm
don't
so
want to
glad